All right, so it's my pleasure to provide an update from the Developmental and Reproductive Toxicity Working Group. Next slide, please. And by now, this is starting to look somewhat familiar, right? So the mission of our group is to develop screening strategies to reliably identify botanicals that are developmental or reproductive toxicants. So we've selected a series of tools, both in silico and in vitro, as well candidate botanicals, and we're evaluating their performance via case studies. Next slide, please. So this is the composition of the working group currently, and I might make a plug here and say we're open to new members. If you're interested in botanicals and DART and NARM, then this might be a group for you. Okay, next slide, please. So we know that DART is a complex series of processes, and it's impossible to capture all of that in one assay. So rather, we've been looking at a battery approach, and on the next slide, you can see sort of the essence of that. So we've got tools that we're utilizing that center around mechanistic insights, the transcriptomics there at the top right, early developmental processes, the biomarkers, critical functional targets, the pharmacology profiling, as well whole organism biology within non-protected life stages, the phenotypic assays, which are the zebrafish embryo and C. elegans. Now, you may remember me talking about those in a bit more detail last year, and I'm going to recap on some of it again this year, particularly with our case studies in focus. So next slide, please. So we just had a small number of case studies in our first go around. We focused on 5 botanicals because they're associated with DART concern to varying degrees. So blue cohosh, for example, is known to bring about labor, menstruation, and cause developmental effects, whereas something like Asian ginseng, as Connie mentioned earlier, a pan-negative, but it specifically had data that indicated it was not a cause for concern in respect of reproductive or developmental toxicity. And so for those of you that were present last year, I focused on those 2 botanicals and showed data specifically for those. This year, next slide, please. I'm going to provide some updates to show how we've extended our case study list of DART relevant botanicals. Also to make a plug for hopefully a forthcoming strategy paper, pending publication. I'll show an expanded analysis of the transcriptomics data now for all 5 of those botanicals, as well share some new data generated with pharmacology profiling assays, and finally put some of that stamina data I showed last year, particularly the developmental toxicity potential, into an exposure-based context. Okay, so next slide, please. We now have a grand total of 18 case study botanicals for DART. I'm not going to go through all of these. The greens are where no activity is expected. The blues are where we expect activity. So let me pick on a few. Something like tree tobacco, second up from the bottom. It's known to cause limb and craniofacial malformations in grazing livestock. And the effects are linked to a piperidine alkaloid, which is called anabasine, which is an agonist of nicotinic acetylcholine receptors. Something like false hellebore, Veratum californicum, well, that's classical teratogen, right? In grazing livestock, it causes craniofacial malformations, and the effects are linked to steroidal alkaloids, something like cyclopamine, and it inhibits hedgehog signaling by binding to smoothen. So we've really tried to extend our list of DART positives. As well, we've included botanicals with no expected DART concern, and for that we've focused on common fruits and vegetables. Now, we anticipate these might exhibit broad but low potency bioactivity in the in vitro assays, whereas the positives maybe will have higher potency or more specific bioactivity. So by incorporating these common sort of items as fruits and vegetables, it gives us a means to contextualize and interpret the NARM data from our so-called positives that are under investigation. Next slide, please. So this is just a plug, like I mentioned, for the strategy paper, which describes all of our assays and our botanicals in detail. And we've submitted that to Birth Defects Research, so stay tuned. Next slide, please. So this is just a recap, the new data I'm sharing with you this year, transcriptomics data, the biomarker data into exposure context, and the pharmacology profiling data. Next slide, please. So there are a few builds in this slide. Maybe just build it all now because it might be a little easier to talk it. The transcriptomics data I introduced to you last year. We use it for connectivity mapping analysis to gain broad mechanistic insights. And there's a lot of data that gets generated in multiple cell lines. We're using 4 cell lines here, HETG2, MCF7, A549, not 8, sorry, and iCardiomyocytes. We test at 3 concentrations, and we do the CMAP analysis on the lowest concentration that affects gene expression in the most responsive cell line in the absence of cytotoxicity. So I showed a couple of these examples last year for ginseng and for blue cohosh. Now, in the case of the ginseng, we saw connections to ginsenosides, which we know are active compounds in the roots. We also saw connections to anti-inflammatory and antioxidant compounds, things like caffeic acid, as well as some anti-malarial alkaloids. And we saw connections to substances that have neuroactive properties acting through the GABA reuptake inhibition pathway. For blue cohosh, we saw connections that really had distinct implication for DART. So we saw connections to cardiac glycosides. We saw connections to mycophenolic acid, which is linked to spontaneous abortion and congenital malformations. We saw connections to progestins, which are obviously acting through the progesterone receptor, used for contraception and menstrual cycle regulation, and also connections to plant alkaloids that inhibit acetylcholinesterase, as well the nicotinic acetylcholine receptors, amongst other effects. that would be linked to neurotoxicity. So by taking that similar sort of approach, looking at gene expression, looking at similarity to other compounds and their gene expression patterns, we're able to start to draw inference on mechanisms. So next slide, please. This is a summary of the analysis of the transcriptomics data using connectivity mapping across all 5 of our current phase 1 botanicals. So as I mentioned, blue cohosh connections have distinct implication for DART. Ginseng extract is making the connections we would expect it to make based on what we know of its pharmacology as well active compounds. For usnea lichen, we saw mechanisms that related to integrated stress response and cell stress pathways. For milk thistle, we saw connections to a known active compound in the botanical, taxifolin, as well mechanisms that related to cell stress, to anti-inflammatory properties, to metabolic regulation, and cell signaling pathways. And finally, for ashwagandha, we saw connections again to a known active compound in the botanical with the ferrin A, and mechanisms that related to heat shock protein inhibition, anti-inflammatory properties, and oxidative stress. That's all very interesting, you might be thinking, but what does this mean for DART? Well, let me share now some of the pharmacology profiling data on the next slide, please. So this is new data. I think it could be really interesting to compare this data with that the cardiovascular working group have generated. We generated it to investigate affinity to specific biological targets. And the panel that we use comprises of 84 assays that are defined in a publication coming from the International Collaboration for Cosmetic Safety. First author is Matthew Burbank, and it includes DART-relevant G protein coupled receptors, ion channels, transporters, nuclear receptors, enzymes, things that we could link to known DART mode of action. So we used here a single test concentration, which was selected based on a 1 in 1,000 dilution of maximum soluble concentration in DMSO. Now we saw a number of hits with usnea lichen, with blue cohosh, and also with milk thistle, some of which are DART relevant, as I've indicated with the red text. I'm just going to pick on a few to talk through what that could mean. So with blue cohosh, for example, the hERG channel inhibition would indicate potential cardiovascular concerns, as it is linked to the risk of serious cardiac arrhythmias. Something like the nicotinic A4B2 receptor activity, which, by the way, with blue cohosh, we also saw in the transcriptomics data, is linked to central nervous system effects. And the progesterone receptor activity, again, we also saw that in transcriptomics, would be critical in ovulation, implantation, and early pregnancy. Now, on the other hand, with some of the lower test concentrations of other botanicals, something like Asian ginseng there, we only saw one target affected. So Asian ginseng inhibited COX-1, which is thought of as an immunomodulatory target, although inhibition of COX-1 during 3rd trimester of pregnancy would be a possible risk for delayed onset of labour. So next slide, please. We had quite some discussion when we were setting up these pharmacology screening assays about how to approach test concentration. We got the data we got by testing at this maximum soluble concentration with a 1 in 1,000 dilution. But it's interesting to see that as the concentration of the botanical increases, so does the interference that we saw. And there are a few different interferences that were noted, non-specificity, as well, just general interference because of the fluorescence nature of the test. So build the slide, please. So I think one of the next steps here with this data set is to sort of reevaluate how we approach the testing concentrations, perhaps using knowledge of Cmax, which I'll talk about shortly, of key constituents rather than this maximum soluble concentration approach. But also we would like to follow up to obtain IC50s, which is a measure of potency, and that will help us determine the nature of criticality of interaction as we compare with systemic exposure. So next slide, please. And this is sort of the last data set that I want to share with you. This is an evolution of the original Stemina data that I showed last year. So this data set, I believe I showed last year. It's the DevTox Quick Predict data set, which aims to define this DTP, and that's based on the ratio of ornithine to cysteine, the two metabolites that Stemina use as predictive biomarkers of developmental toxicity, which is kind of a biomarker indicative of toxicity during organogenesis, so relevant to the first trimester of pregnancy. And here we have exposure that spans a range of 8 treatment levels, and again, that's based on an upper test concentration of 1 in 1,000 dilution of the maximum soluble concentration in DMSO. And there are 3 types of responses that we observed in the data. So we had responses in the ornithine cysteine ratio in the absence of or prior to a cell viability response. So that was seen for the top 3 in the table, blue cohosh, Bosnia-lichen, and at a lower potency, ginseng. And then we had a response where the ornithine cysteine ratio and cell viability are seen at a similar concentration, well, within 3-fold of each other. And that was something we saw with milk thistle. Actually, that material, you can see from the curve here under category 4, it elicited a biphasic response in the ornithine cysteine ratio, which probably is due to an increased cysteine uptake prior to cell death, may be more of an adaptive response to oxidative stress. And we didn't see a response in the ornithine cysteine ratio or cell viability with ashwagandha, but no, the doses tested are considerably lower than for the other test articles. So now next slide, please, and go ahead, please, Julie, and build the slide here. We do now have some exposure information for key constituents. That's come from Yutong Liu at the FDA. And the premise to using this data is really that if a chemical is not bioavailable, then our positive in vitro results would not translate to in vivo effect. So Yutong has used a high throughput PBPK model here from Simulations Plus, and it's a simplified model, I understand, which includes stomach, intestine, liver, and sort of central general circulation compartments for what is a 70-kilogram human. And she's used that model to simulate fraction absorbed, oral bioavailability, maximum plasma concentration, Cmax, which is what I'm going to focus on, and some other ADME properties for each constituent coming from the chemical analysis at 3 different doses, 1, 10, and 100 milligrams orally for 24 hours. So I'm showing here on the slide, what the lower Cmax is, what the upper Cmax is for each of the constituents where she's generated using PBPK modeling these Cmax values. And, I've actually aligned the daily doses of Botanical. Again, it'd be good to get input from the pharmacognosist there. For more certainty, but when these Cmax values are, or rather, so when these constituents are aligned with the daily doses of botanicals, the Cmax values are highest with usnea lichen, followed by milk thistle, followed by ashwagandha, then blue cohosh and Asian ginseng. So they're not all created equal. But we can now actually start to use some of this systemic exposure information to put some of our in vitro data into context. And that's the next slide. So here we're comparing the DTP concentration with those Cmax values, both at the lower as well the higher end. If the ratio is within tenfold, Stemmer would classify a substance as a developmental toxicant according to this assay, and if it's greater than tenfold, it would be considered a negative. So we have our blue cohosh and our usnea lichen coming out as positives, and our Panax ginseng and milk thistle coming out as negatives. Could you pop the build on the slide, please? I mentioned earlier ashwagandha was tested at a pretty low dose, and after some discussion with Stemmer, it might be worth to actually retest that at a higher concentration as well. It would be good to fill in some of the gaps in PK for constituents that have structural alerts for developmental and reproductive toxicity. I haven't shown that data today in the interest of time. There are some constituents that had alerts using the dark decision tree that P&G developed that's in the OECD toolbox. They are included in the blue cohosh data shown here, but there were alerts for some of the other compounds for which the PK has not yet been done. So it would be good to include those. So last slide, just to wrap up the data that I have shown today. It does seem that, through mechanistic insights, understanding critical functional targets as well, these early developmental processes and biomarkers that associate with them, we do seem to be able to detect botanicals with a higher potency for DART-specific activity. And we do seem to be able to put those into context relative to human exposure. We'd like to integrate more the use of the in silico DART tools. Like I mentioned, I think there's an opportunity to guide PK predictions with that information. We do have zebrafish embryo and C. elegans data, and we're still analysing that. We'd like to integrate that data also, because that's the whole organism data, the more systems level perspective. So it'd be good to see how that aids the decision making. And I think that we also need to be thinking about, what is too low and what is too high by way of test concentrations in these assays. We saw some of that too high with our pharmacology screening. We saw some of that too low with our Stemina DevTox assay. So it would be good to bring more into the picture the systemic exposure considerations for key constituents. Okay, and then finally, just some of the outreach. We've been to a few meetings this year, some specific teratogenicity meetings. There's John Rogers at one. I think he then went to another one in the UK later on. We had a nice session at Eurotox. It's been mentioned already, GeneTox, cardiovascular were there, as too was DART. So yeah, a nice bit of outreach. Our plans for 2026, as shown here, are really finalising this review of our first 5 botanicals and publishing a case study paper to get the data into NIEHS's database, KEBS. And we are talking as a team about what additional assays we might be able to bring in that are readily available. ReproTracker has come to our attention. And of course, we've now got a much larger set of case study botanicals, positive and negatives, that we want to progress with testing on. And with that, I will thank you for your attention and happy to take any questions.
Thanks so much, Catherine. That was a tour de force of a lot of data we've generated, not even all of it, and really cool benchmarking work that we're starting to explore. We have some questions, on concentration. I think you addressed a lot of them as you went, or just comments about them. So I might leave those for now. One question from Gina Montoya asked about how confident are you that the observed effects are attributable to the composition of the extract itself, rather than the presence of contaminants, impurities. I don't think this is specific for DART, but maybe Catherine, if you'd like to answer it.
Yeah, I might punt it back to you, because what we do know is that a lot of work was done up front by the chemical analysis working group to, one, characterize the botanical that we're testing, so we know that it is what it says it is, and two, do some sort of basic quality tests, right?
Exactly. And the point about, contaminant, we weren't able to do it for every single one. So that might be an outstanding thing. If we saw anything unusual, our plan was to go back and test for the ones we didn't maybe have enough material to prioritize it initially. But, our thoughts here is that we're seeing kind of the effects we expect. This is really meant to be a first pass. Do these assays, how are these assays performing? Are they suitable? And then, as Catherine said, kind of this going back and iterating on concentrations, additional botanicals. So I think it's a fair comment. We don't totally 100% know, but I think we have good confidence based on the analytical we did and the results we're seeing. All right, Bill asked a question about the HPTK model, and this might be a Yitong question, so we can ask her when she's back if you don't know. Catherine, do you know if it's only in fasted conditions, or can the model also be affected or changed based on food bioavailability? Do you know that offhand?
I don't, but I think we've got a number of questions for Yitong when she's back. About the Cmax, also as it relates to pregnancy, lactating women, in addition to the good questions that Bill is asking. So yeah, I think it would be good to have that deeper dive across working groups to flesh some of this out.
And one other question on the PBPK modeling, did we prioritize compounds? Do you want to talk about how we did that?
Well, my understanding from looking on the data is it really lines up with some of what was analysed, but not all of what was analysed. So back to my point around needing to re-loop on that to make sure that we are looking also at compounds we would be interested in from a DART perspective is, I think, an important next step. So we haven't got everything in, and our in silico models might suggest there would be some other compounds we might want to bring in.
Yeah, it's been tricky. We've tried to do what we quantified, but of course there's other things in those plants. All right, let's do one last question from Dave Allen. He asked, is the tenfold difference from the in vivo exposure selected just based on an order of magnitude? And or was there an in vivo considerability in deriving that threshold?
Yeah, good question, Dave. Again, one for Yitong, right, to sort of help us understand how those Cmax values are bounded by uncertainty. I don't think they are currently, but again, something that we'd want to reloop with her on when she's back.